This is an anatomy textbook from the mid-20th century. Note the blank space in the pelvic region. Until the 1970s, the primary organ of female pleasure was entirely absent from standard medical literature. The anatomy was simply left unmapped. Physicians trained for decades without seeing a single accurate drawing of it. Because medical science ignored the hardware, individuals and partners have been forced to navigate this territory blindly, without an accurate map of how the body actually works. Most education focuses on a single surface-level point on the skin, but that visible area is an illusion that hides a massive, highly complex system running deep within the body. We cannot stimulate or maintain a biological ecosystem that we were never accurately taught exists. This diagram reveals the true scale of the clitoris. Far from a single external point, it is a large, three-dimensional structure that resembles a wishbone, wrapping deeply around the vaginal canal. The visible tip accounts for only 10% of the organ. Because this area is a concentrated node of nerves, applying intense, monotonous friction directly to it often leads to irritation and discomfort rather than sustained pleasure. The remaining 90% is hidden inside. It consists of the crura and the vestibular bulbs, thick legs of tissue constructed entirely of nerves and blood vessels dedicated to a single biological purpose. This hidden network requires a different method of interaction to activate. External rubbing on the tip does very little to engage the massive internal structure. Understanding this internal size changes the objective. You stop trying to press an isolated button and start engaging a whole body neural network. This diagram shows the location traditionally identified as the G-spot. Rather than an isolated button, it's actually the back wall of the internal clitoral nerve network. 60% of women don't possess a sensitive spot here. Your anatomy is entirely normal. A lack of internal sensation is not a biological defect. It simply means your body utilizes different neural pathways to activate the system. This comparison illustrates two different approaches. The first is mechanical, relying on monotonous friction. The second is state-oriented, managed by the whole nervous system. Look at the black jagged line. Localized friction builds tension to a sharp release that drops off instantly. But look at the golden trend line. Shifting to gentle pressure creates sustained, rolling waves of pleasure that do not crash immediately. True vaginal orgasmicity, highlighted here in the top row, is not achieved through aggressive rubbing. It happens when whole-body arousal primes the vaginal tissue to become hypersensitive, leading to a radiant, prolonged physical state. Pleasure is a continuous activity within the nervous system. It is a state you enter, not a mechanical task you complete. This flowchart details the impact of aging. As estrogen drops during midlife, the body sees a severe decrease in vital blood flow. Without it, clitoral tissue shrinks, vaginal tissue loses elasticity, and concentrated nerves become less sensitive. This cellular diagram illustrates the difference. Hormone-supported vaginal cells are plump and hydrated, resembling jelly donuts that can stretch immensely without tearing. Without hormone support, those cells flatten out, becoming thin and dry like sandpaper. Stretching this brittle tissue causes painful microtears. Physical pain or a sudden loss of sensation is a structural, cellular hardware issue, not a psychological one. This diagram maps out a restorative medical solution called the O-shot. It uses platelet-rich plasma, or PRP. A sample of your own blood is spun in a centrifuge to isolate the plasma, which is packed with healing factors. Under a microscope, we see the results. Once injected, the PRP signals your native stem cells to proliferate new collagen, blood vessels, and nerve endings. Over several weeks, the tissue physically regenerates. New blood vessels and nerve pathways bloom across the surface, reversing shrinkage and restoring natural lubrication. There is also a structural benefit. Because the anterior vaginal wall supports the bladder, injecting PRP here thickens the tissue, frequently reducing or curing midlife urinary incontinence. By regenerating these cells, medical science can return dry sandpaper tissue back to the elastic state of hydrated jelly donuts, restoring physical function. Lifelong vitality is an ecosystem supported by three pillars: accurate education, technique focused on the nervous system, and the physical preservation of your hardware through hormones or PRP. Pleasure is a core biological design. It requires conscious care, physical maintenance, and honest communication to thrive for a lifetime. Discard the outdated myths and understand your true anatomy. By prioritizing cellular health and physical care, you can sustain your vitality for decades to come.